So just to piggyback off of what Colleen's done from her movement assessment, related to the knee, I will look at some of the muscles that can either directly influence the knee from a mechanical perspective or from a pain referral perspective. So as Colleen pointed out, a lot of these fascial points are where muscles are and overlap, and there are often significant relationships between where you find trigger points and need to treat them compared to the fascial points. So what I'll do is teach you how to evaluate and treat some of these trigger points manually, and then what you can do is apply that same technique to basically any muscle in the body. So when it comes to palpation of a trigger point, regardless of the muscle, you have to know the anatomy and you have to know the fiber direction, because it's very important to do a cross-fiber palpation in order to pick up a trigger point. If you palpate parallel to the fibers, you will not pick up a trigger point as if you were palpating perpendicular to the fibers. And we know that the fibers run down this way when it comes for the quadriceps. So with that being said, I need to palpate perpendicular to the fibers. So we'll start with the VMO. Let me have you straighten your knee again. So here it is through here, just to make sure that I'm on the correct muscle. Okay, and then go ahead and relax. And what I'm going to do is go through and use either my index or middle finger, even though both are resting on the muscle. I don't want to palpate with both because it's twice as much information. And where he feels pain might not be the area where I'm picking up the restriction. So I'm going to start with my middle finger, and then I just very gently go through and assess for any type of taut band first, which would be an indication that there's a trigger point within that muscle. But then, once I find the taut band, got a little something right there. Yeah. As I started working in this area here, it just all of a sudden felt a little bit thicker and denser compared to the other part of the VMO. With that, it's telling me that there's a taut band within this muscle, and so I need to assess the entire component to find the area that is the worst. So then what I can do for treatment, now that I've found an area, is I can either use that same finger, I can just switch to my thumb, and I'll confirm I'm still on it. Am I still on it?
Yep.
Okay. I give a compression to the trigger point, and then there's one of two ways that I can manually treat it. I can do a passive technique where I just slide either more proximal or distal along the fibers, and you can go more into the restriction or away from the restriction depending on the patient's tolerance and how you view tissue should be released. And we'll go up that way a little bit. And then you can just hold it and you wait for it to soften. As you're keeping the pressure, you can also continue to wind the tissue a little bit, adding a little bit of rotation or a little up and down to take up that slack, and you just keep holding it. And to treat it actively, what I can do this time is keeping the compression on that trigger point. Now let me just have you straighten your knee just a little bit. Good, hold it, and then let it relax. Good, and that was uncomfortable to lift? Okay, that'll get a little bit easier as we continue to do it. Straighten again a little bit, good, just hold it, and then relax. Make sure you completely relax in between each repetition, and then go ahead and do it again, and then relax. And you want to make sure that they don't extend or kick on any muscle too much, because then it'll push you off. We're already working at end range extension, so that won't be an issue.
Now, you mentioned a twitch response. So what are you feeling for? What are you trying to identify while you're palpating?
So what happened was when I gave a little extra pressure on the muscle, I was able to see a flicker within the muscle, and that's an indication that you are over a trigger point. It's actually more challenging to elicit a local twitch response manually with palpating than with dry needling.
And do you see a better response if you get a twitch response?
With the manual treatment, it doesn't make as much of a difference because the technique is different. However, when you're doing the needling, you should elicit a twitch response, because if there's no twitch response, then you did not needle the trigger point. So the other part of the muscle that I'm going to check is the vastus lateralis. And I'm going to check it on this more anterior portion versus the posterior portion where Colleen was. You can see, as I go through and palpate here, he definitely has a lot more guarding. And it's worse here, much worse. You can see him kind of flinch. That's a nice little twitch right through there that you can see in the muscle. Let's see if we can get that again. Yep. Right. right in through there. You can see a little bit of a flicker. So to treat this, again, fibers run this way, which is how I was palpating. I'm going to get over that worst spot of the trigger point, and it's definitely more there. Yeah, you do not like that. So I'm going to compress on that trigger point, and then the same thing. I can just slide towards the knee or towards the hip to help stretch. If I don't feel like I'm getting a response, then I can do the active movement. So go ahead, just straighten your knee just a little bit. Good, perfect. And then let it relax. So that's the way that you could treat the quadriceps for manual treatment of trigger points. A couple other areas that would be interesting to look at just related to stability and function would be muscles like the gluteus medius minimus as well as the gastroc because of his limited dorsiflexion ability to squat. So the gastroc, you have a medial and a lateral head. Fibers are running this way. And for the medial head of the gastroc, it's easier to assess in a pincer palpation using your thumb and middle finger. Okay, and let's check the lateral head as well. So a little bit different palpation. It's not as mobile as the medial head, so it's more of a flat palpation. Again, fibers run this way, so I'm palpating perpendicular. The amount of pressure, you should always start a little bit lighter. If you go too deep to start with, then the tissue will fight back and you'll get a false positive result. This is not as bad. It's a little tight here, but it's, I feel that your medial head is worse than your lateral head. What would you say?
I would agree.
Okay.
It's a lot more sensitive on the medial side.
Yeah, so we're gonna go with there. So let's go back and just check for that worst spot again. Again, going perpendicular to those fibers. So basically what I'm doing, if you can envision my fingers being fibers of the muscle, I'm grabbing from the underside and I'm trying to let the fibers slide through almost individually from my fingers to feel for that top band. And we'll say if my middle finger was the top band, then my goal is once I slide off of it is to get back onto it and then go through and assess on that top band where that trigger point actually is. It'll be an area that feels more nodule, thicker, denser, and it's usually much more painful than the rest of the area. And then that's where I would decide to treat. So then what I can do is just by compressing that trigger point between my thumb and middle finger, then I'm just going to ask you to actively and gently just point your toes. Let's see, I will be curious now to compare if you want to go ahead and stand up.
Ankle feels a lot looser. It's like it's really moving.
And turn that direction. Okay.
So, I mean, and this is a great example of just doing a little bit of treatment to the gastroc can help to improve dorsiflexion, which can help to improve function, and something that you didn't even realize was that much of a problem.
Right.
There actually are some published articles from Rob Grieve that look at manual treatment of trigger points in the gastroc soleus, doing an ischemic like compression or what they call just a manual trigger point release, and it can make some very nice differences. And
Yeah,
it's
I
nice
can
to see
tell.
it live in person as well as on a research article.
Yeah, it feels great. Like $1 million.
Okay.